Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Naha Abalada from Roots Community Health Center, reporting for the week of March 27th, 2023. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Taking a look at community transmission by county nationwide, we can see that about 53% of the United States is in high or substantial transmission. This is calculated using new cases as well as percentage of positive cases. And even though we know that cases are being undercounted, still over half of the country is either in high or substantial transmission levels. Here in Alameda County, we are currently in the orange, substantial transmission, as is much of the Bay Area. Now taking a look at U.S. current virus levels in wastewater. And I think we're still really learning how to make this useful, but the warmer colors indicate higher virus levels and the cooler colors are lower. And the link to this map is in the post in case you want to click on your area. But we can see it's kind of a hodgepodge everywhere, but certain states like Nebraska have a majority of wastewater sites with high levels, whereas we can see on the East Coast, there's big clusters in the blue indicating low virus levels. Trying to get a sense of what's going on average nationwide. There's a lot going on this chart, but this is the one I'm going to try to get used to looking at and try to get us used to looking at. And the reason why I like this one is because it shows a few important things. First, that black line there is the number of sites that are reporting. And this is important because, of course, the more sites reporting, the better. But also it helps make sure that we're not comparing apples and oranges. And what I mean by that is if we were to go back to a year ago, there were so many fewer sites that it would probably be hard to really compare what was going on in the wastewater than compared to now. But for the past 4 or 5 months, we've had somewhere around 1,200 different sites across the country reporting, and that's about triple what we had this time last year. So hopefully we'll see this black line keep going higher and higher as more sites are added. And this may very well be the way that we track the pandemic into the future. The other thing to note on this graph is what's going on in the last couple of weeks. And that would be the rightmost part of the graph that's kind of shaded in gray. Because if wastewater concentrations are headed up, then that will likely translate into increased cases following that. So the gray shaded area on the far right side of the graph is where we can see what's going on in the last couple of weeks. And that is incomplete data still. And so we'll watch it keep getting updated like most of these graphs. But the red and the orange area are really what we're going to be keeping a close eye on because those are indicating large increases or increases in the level of virus. And as you can see, there's a fairly steep increase there in the last couple of weeks for both the red and the orange area. So we're seeing an increase and we're going to want to see over time what this correlates to. And what we expect it to correlate to is hospitalization and death. So at some point, we're going to see if wastewater concentrations will essentially replace case counts in terms of our ability to track the pandemic. And I think this is just one of the changes that we'll be adjusting to as the way that the pandemic is reported or not reported continues to evolve. Now, taking a look at variant proportions, XBB.1.5 continues to increase. And we also have a new variant on the tracker, XBB.1.9.1, that's now at 2.5%. This variant seems to be increasing quite a bit in Australia, which seems to be driving some increases for them. There's also XBB.1.16, which isn't really significant here in the United States, but it is causing some trouble in India and in the UK. So they are keeping a close eye on it in those countries. India does seem to be having a surge in cases driven by XBB.1.16, and the UK just reported their largest number of cases in any week this whole year so far, with 1.5 million cases in 1 week. We used to really look at the UK because often their waves would come first, then New York, then across the country to California. But it's not really clear that we're going to be following those types of patterns anymore. And that seems to have to do with what is circulating locally and what is going to outcompete what. So far in the United States, XBB.1.5 is hanging on at about 90% of specimens nationwide in the purple there, and it's pretty well taking over. The other two variants I mentioned, XBB.1.9.1 and XBB.1.16, are actually both offshoots of the XBB variant. So we're hoping that they don't diverge too much, that they won't be a whole lot different than what we're dealing with now with the XBB.1.5, which we know is an extremely, extremely contagious variant. And it doesn't seem to be more or less severe than the variants that came before it, but it is quite a bit more contagious. So this is why you might be hearing about outbreaks and gatherings that are becoming super spreaders, even if everyone's vaccinated, just because of how contagious this variant is. Daily deaths are coming down slowly, much like this time last year, but it's still too high. We're at an average of 249 deaths per day, which amounts to over 1,700 deaths per week, over 1,700 deaths per week still. And actually, this whole time since the pandemic started in 2020, the lowest number of deaths we've had in 1 week is 1,347. And that was back in April of 2022, about a year ago. So it's been higher than that for a whole year. So I'm certainly hopeful that we'll continue to trend down and that we'll actually get below that low, that pandemic low. So we had a pandemic low a whole year ago, and that's kind of disappointing because we're in a worse situation now, even as it relates to deaths, even with our treatments and everything that we have. So this is some context, I think, for us. And we'll just have to wait and see how it goes. For us to be posting these kind of death numbers for over a year now, it's just definitely disconcerting. So far in 2023 in the United States, over 34,500 people have already lost their lives to COVID. Over 34,500 people in 2023. We're not even done with March yet. And all told, we are upwards of 1.1 million deaths as a direct result of COVID in the United States and counting. This does not count post-COVID events or deaths that happen more than 30 days after the original diagnosis of COVID. It doesn't count any of the long-term effects of COVID, which also can be life-threatening. This is just related to the acute COVID infection, more than 1.1 million deaths. This is certainly a nationwide trauma and loss. And it's still going. Taking a look at hospitalizations, we can see that those are coming down, but unfortunately still higher than we were this time last year. So just another reminder that we're still very much in it. We're still very much experiencing the effects of this pandemic. And today, we have more people in the hospital with COVID than we did this time last year. So again, hopeful that will keep coming down, but we're still very much in it. And there's nothing objective that's telling us that we are not still in it. Here in Alameda County, we do see the numbers looking a little better. This is about the third week in a row that we've seen these hospitalizations slowly making their way down. Currently, we have 82 in the hospital, 9 of those in the ICU. Currently in Alameda County, our test positivity rate is 6%, but the actual amount of testing continues to go down. So once again, cases are not a reliable indicator, but 6% is a high positivity rate. Looking at our wastewater concentration here in Alameda County, we can see it's kind of level compared with last week, but still higher than we were even just this past January. So I think it's safe to say we still have a fair amount of COVID circulating around in our environment. And I think in recognition of the fact that cases are less reliable and wastewater will be an important tool, Alameda County has indicated that they will be putting wastewater on the public COVID dashboard. So we are keeping an eye out for that. Now I want to turn to a bit of information about maternal mortality in the United States. Now, even before the pandemic, maternal mortality rates in the United States were quite shameful. When you compare to other so-called developed countries in the world, the United States already had the highest maternal mortality rate. So even though this country spends the highest percentage of our wealth on healthcare, this very basic indicator, maternal mortality, is shockingly high. Then we added to this the pandemic and our very poor performance as a country in this pandemic, and things have only gotten worse. This report came out this month from the National Center for Health Statistics, and one of the vital statistics that we look at is maternal mortality. Maternal mortality and infant mortality are actually indicators that we use to determine the status of a population of entire countries. It's how we sometimes talk about other countries as being developing nations and still having bad maternal and infant mortality rates. By that standard, the United States is not doing well at all, and actually it's only getting worse. The World Health Organization defines maternal death as the death of a woman while pregnant or within 42 days of termination of the pregnancy from any cause related to or aggravated by the pregnancy or its management. So this does not count accidents or incidental causes. It has to be related to the pregnancy. And what this report essentially showed was an increase from 2018 to 2019 to 2020 to 2021. In 2021, 1,205 women died of maternal causes in the United States. This is up from 754 to 2019. So in 2 years, we went from 754 to 1,205 women dying of maternal causes in the United States. And the maternal mortality rate, so the rate is deaths per 100,000 births. So the maternal mortality rate in the United States went from 20 in 2019 to 33 in 2021. This is a very significant increase, absolutely heading in the wrong direction, especially in a country of the wealth of the United States. And when you look at maternal mortality for Black women, it was 69.9. That is 2.6 times higher than the rate for white women. And this is a particularly terrible disparity, and it actually affects Black mothers of all income levels. So this is something that we have a lot of work to do. The increases from 20 to 21, though, were significant for all races and ethnicities. Essentially, no race and no age group was spared. If we look at it on the graph here, you can see it very clearly. That group of bars to the far left is the total. So you can see an increase from 2018 up to 2021, and the biggest jump being from 2020 to 2021. And when you look at each racial and ethnic group shown there, Black, white, then Latino, then you can see that the increase in 2021 compared to 2020 is significant in every single group. But overall, of course, we are seeing much poor outcomes in Black mothers. And really, this has all been worsening every single year, even pre-pandemic. Now, what are the exact or direct impacts of SARS-CoV-2 infection on pregnancy? Well, there have been a number of different studies. I've reviewed several of them here over the last couple of years, and really each one shows a significant negative effect of catching SARS-CoV-2 during pregnancy. But each study's kind of done a little bit differently. And I've reviewed some of the smaller studies here, but today I wanted to highlight two analyses because they are more comprehensive, they're larger, and they look at multiple different studies. And so the first study is published in the BMJ, or the British Medical Journal, and it took a look at 12 studies in 12 different countries involving over 13,000 pregnant women. So this is a meta-analysis where we're looking at multiple different studies. And what they did was they took individual records of pregnant people and put them together and analyzed them. And what they found is that infection with SARS-CoV-2 at any time during the pregnancy significantly increases the risk of severe outcomes, both for mom and for baby. Moms are at increased risk of going to the ICU, of being intubated, of going on mechanical ventilation so they can't breathe on their own. And this can be very dire for a pregnant mom and baby. increased risk of getting pneumonia, and increased risk of death. All of these outcomes were significantly increased in those with SARS-CoV-2 compared to those who didn't get SARS-CoV-2. And babies were more likely to go to the neonatal ICU or be born preterm or be born low birth weight. There was no correlation to stillbirth, but going to the neonatal ICU, being born preterm, or being low birth weight were all more significant or were significantly different for those whose moms got SARS-CoV-2 versus those who did not. Now, this particular study did not compare unvaccinated to vaccinated. So it's just letting us know that in no uncertain terms, catching COVID during pregnancy can lead to poor maternal outcomes, including death, and poor baby outcomes, or both. This next study, published in The Lancet, was also a large-scale study, and this one was looking specifically at the onset of the Omicron period. This was a large study that looked at 41 different hospitals across 18 countries, including the United States, and this study enrolled 4,618 pregnant women during the Omicron time, so from late November 2021 to June of 2022, so kind of the first 6 months or so of Omicron. And what they did for the study was they matched women who had caught COVID, one woman who caught COVID with 2 women who didn't get COVID, and then they did the analyses and looked at their outcomes. And from there, they were actually able to calculate the effectiveness of the vaccine against severe outcomes. So for those who caught COVID, they found that vaccine effectiveness against poor outcomes, so the severe outcomes, the effectiveness of the vaccine was 74% if you got the primary series and 91% after the booster dose. This is a really significant effectiveness of the vaccine for pregnant moms against severe outcomes of SARS-CoV-2. And they found that the risk of being unvaccinated was much like what we just went over in the BMJ article. So although this study focused on the moms, not the baby outcomes, but the moms, they found increased risk of ICU and death in women who caught COVID, especially in those who had symptoms and especially in those who were not vaccinated. And what they stated were the implications of this evidence, and I'm reading now from the study, says vaccinating all pregnant women, especially those who are overweight or obese, with the booster dose is a public health priority, as it is very difficult to predict who is going to develop severe symptoms and complications of COVID. And this is what we've been saying about COVID since the beginning. It's very unpredictable. And in pregnancy, we have established now how severe these outcomes can be for mom and baby. So if you or someone you care about is pregnant, there's absolutely no reason to go without the vaccine. We've not seen any safety signal, any safety issue from taking the vaccine, even when we just look at pregnant women. Yet we have seen really bad outcomes and even death from not having the vaccine. And getting the vaccine will protect the baby for the first 6 months of their life, since babies under 6 months old are not eligible for the vaccine themselves. So protect the baby for the first 6 months of their life when they're vulnerable. And we just went over last week how babies are being hospitalized, especially babies who are born premature. And will protect moms who are unvaccinated and catch COVID are at significant risk. I know that we think of pregnant people as generally young and healthy, but pregnancy is a very particular state with extra demands on mom's body, and clearly COVID has shown itself to be a significant threat. So this is a high priority area, and we really need to get the word out about the importance of vaccination for pregnant people. Remember, we continue to be in a pandemic. The World Health Organization states that the ongoing COVID-19 pandemic continues to constitute a public health emergency of international concern. This is the highest alert that the WHO can issue to the world, and it still applies today. So even though the United States declaration of a public health emergency is expiring on May 11th, this is an administrative decision. The pandemic is still ongoing. There's still quite a bit of SARS-CoV-2 circulating around in our environment. The variant we're dealing with now is highly contagious, And COVID is now the number 3 leading cause of death in the United States, including being a leading cause of death in children. And an untold number of people are having post-COVID complications, including heart attacks and strokes. And an unknown percentage of individuals are ending up with long COVID. And we still don't know how to predict who's going to get long COVID. There are people who catch COVID and do just fine with no lingering effects the first time. Then the second time, they end up with long COVID. This is not something we know how to predict yet. And even though we are learning more every day, we just aren't there to understanding what is the cause or what are the causes, who is at risk, how do we manage it. We do not have any cure or really any treatment. And at least until we do, I think it's a good idea to try to avoid rolling the dice with COVID. I mentioned last week that we are waiting to hear if an extra booster will be recommended, especially for people who are older and immunocompromised, because most of them were boosted in September and now their protection against severe outcomes is wearing off. There are some rumors out here. This one comes from the Wall Street Journal. And unfortunately, sometimes we have to get our vaccine information from shareholder announcements and the Wall Street Journal. And this is just the way it works here. But hopefully one of these days soon, we'll hear something actually from the FDA or the CDC that will be more than just a rumor. Now, we are seeing a lot of people dropping their guard these days against COVID, and it seems to be at least partly because we're not hearing about it very much in the media. And there's definitely a big push to pretend it's over. So that's why we continue to report consistently here every week for those who still do want to know what's going on. Now, if you've decided that you just are tired of wearing a mask, you're tired of taking precautions, and you just want to go out and do things like pre-pandemic, of course, everyone is free to do what it is that they want to do, but it is important just to be clear that what you're doing and that you are operating with an accurate set of facts, that if you're going to do those things, if you're going to, for example, gather indoors unmasked with the public, then this means that you are absolutely risking catching COVID because it's still very much with us. It's very much still circulating in our environment. And we should also still acknowledge that it is still very unpredictable. We don't know who's going to do okay, who's going to have a post-COVID event, who's going to have long COVID. And we still are seeing a number of deaths, and many of those are in vaccinated individuals. Now, the good thing is we have treatment. So you should know now if you're going to be someone who gets treatment if you're positive. And if that is the plan, please make sure that you've had this conversation with your doctor. Your doctor might want you to get labs. So get the labs, get them now before you end up in a situation where they say, you haven't had labs in 5 years. And and so even though we know that you don't have to get labs before you get treated, why not? You have a doctor, you have a risk factor, go ahead and get evaluated for treatment if you catch COVID. Know how to reach your doctor, know how to get treated in a timely fashion. Remember, you only have 5 days from when your symptoms start. So as soon as you start feeling bad, please go ahead and get tested right away. And since we know that can take a while for the rapid home test, the antigen test to turn positive, if you're someone who should be treated, we really just want you to go ahead and get a PCR test because that will detect it early enough so that you can get on treatment right away. And just like with most antiviral treatments, the sooner you start, the better. We're seeing people who start treatment early and seem to have fewer symptoms and a shorter duration of symptoms. Of course, we're going to need more studies to confirm all of this, but this is consistent with what we see with every other antiviral. And it makes logical sense too, because antivirals are actually stopping the virus from replicating and getting to be too much of a burden on your system. So you're not going to wait and see how you feel. That's actually the opposite of what you want to do. You want to plan now before you even have COVID so you can know what you're going to do. And the moment you turn positive, you're going to go ahead and take that treatment without delaying. If you're someone who's not going to need treatment, and this is something that you've already figured out, ideally with your doctor, because some of the things that you may not think are underlying conditions may be even mild asthma. and even a history of smoking and so on. So check it out with your doctor. And if y'all decided that you don't qualify for treatment and you're not going to get treatment, this still doesn't mean just let all your guards down and go ahead and catch COVID-19 repeatedly, because we know that COVID-19 is causing new onset of diabetes, and we know that it's causing other issues. And so you don't want to end up becoming a high-risk person because you decide to go ahead and keep on getting COVID, or even just getting COVID one more time. We don't know how many times a person can catch COVID, but so far it looks like it's an unlimited number of times. There doesn't seem to be any upper limit where you just can't catch it anymore, which is unusual. This is not the flu, this is not a cold. You can catch it multiple times a year. And so we're still learning what this all is going to mean. And we are already seeing indications that repeat infection with COVID has a cumulative effect and increases the risk of almost all of the different post-COVID issues like persistent coughing, heart issues, neurologic issues, and so on. So with each infection, the risk of these things goes up. So if you had COVID once, we don't want you to catch it a second time. And if you had it twice, we don't want you to catch it a third time, and so on, especially while there's still such little understanding about post-COVID and long COVID effects or what to do about them. One of these days, we are going to have a better understanding. We may hopefully have ways to prevent and treat these things, but we're not there yet. So in the meantime, it does seem prudent to avoid infection and reinfection. But if you've just had it and you've decided you're going to start taking some risks, or let's say a loved one has had it and they've decided they're going to start taking some risks more than before, this is each person's decision to make for themselves. But out of care and concern and just mutual respect for one another, let's communicate these things. Let's talk to the people that we may be visiting or gathering with. For example, if you decide that you're going to start doing unmasked indoor activities, which are by definition high risk, if they're with people that have not tested and that you don't know what their activities are, then you may want to stay away from someone who's higher risk or who's still being COVID cautious. At least have that conversation with them. You may want to stay away from them for a good week or so until you're sure that you don't have COVID, or wait 5 days and then test. Or if you just cannot wait that amount of time, consider wearing a fitted filtration mask as potential source control. That means if you have it, you're keeping it to yourself in case you may be infected, so that you don't sicken or even kill another person. So once again, if you'd like to avoid potential bad outcomes or potential long-term effects that we're still learning about from COVID, please do what you can to avoid getting infected or reinfected or spreading it to others. Gather outside, improve indoor air quality, wear a high quality filtration mask like an N95, KN95, or KF94. Use rapid tests for pre-event testing. If you get exposed or if you have symptoms, repeat the rapid test every day or two while you continue to wear a filtration mask, or go ahead and get that more definitive PCR test, especially if you're someone who should be treated if you're positive. Please don't show up to work or school feeling sick and exposing others. Stay home and rest. But if you insist on going out, a well-fitted N95 mask is considered source control to keep you from sickening or even killing another person. We also really want to avoid anyone losing their health benefits at this time. If you receive Medicaid, please update your information so that your state Medicaid office will know how to reach you. If you're in California, the link for you is in the post. If you don't have a primary care provider, please get one. Know how to reach them before you need them. Make a treatment plan. Get up to date on your boosters. If you did not want the mRNA vaccine, we have Novavax, a protein subunit vaccine. Go ahead and get Novavax. Remember to eat a balanced diet. Consider a multivitamin supplement. Get your baseline labs done. Ask your doctor about checking vitamin D levels along with those other baseline labs to see if you need vitamin D supplementation. Get some regular exercise, unless of course you're sick, then get your rest. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Please join us next Tuesday at 10 a.m. We'll see you then.